I, we were talking earlier this week because I was, I mean, if you spend any amount of time with Geetha, your voice is just calming. And then to know that you are also a psychiatrist, I called you because I had been reading about, just recently, I came into the knowledge of this thing called a U-shape, a U curve of happiness. Happiness is generally depicted as a U curve and is based on age. So the younger you are, the happier you are. And then as life happens, paying bills, mortgages, all of these different things around your 40 is like the most depressing time, according to this U curve of a person's life. But then you retire, you have grandchildren, and now you're back on the upswing. And for the first time, probably starting in 2017, this curve has become a little bit inverted, that the most depressed people in our country are young people, ages 18 to 25. And it's not just happening here in America. This particular story is over 83 different countries. And so, Geetha, I called you earlier this week and I was like, help me make sense of this. What is going on with our young people? And you just had so much wisdom. And I asked you to come on and to share a little bit of that.
Thank you, Kathy. So it is not surprising that this is happening. In fact, I would not even think about a curve. Right now, it seems like there is mental health epidemic globally. And so everybody has depression and anxiety. And I think it's across the board, all ages, all groups. I'm not surprised at all. What is the trigger for mental health disorders? Is stress. We are surrounded by stress because of anger, hostility, judgment, name calling every day starting in the morning. And the antidote to that is compassion and empathy. As a psychiatrist, I can tell you compassion and empathy are the pillars of psychiatry. You are compassionate to somebody, and empathy, I don't mean sympathy. There's a difference for those of you who may not be familiar. Sympathy is about feeling sorry for somebody. There's a boundary. It's you versus me. I'm glad I'm not in your shoes. But empathy is actually experiencing what the other person is from their standpoint. And I think we need to do some of that. But as a physician, I can say one of the things that disturbs me is in the medical field, we have done very well for physical health, but not for mental health. And by that, I mean prevention. Prevention is always better than cure. And as you know, in heart diseases, cardiovascular, we have come a long way. Diet, exercise, lifestyle management, we have done very well. But in mental health, you do not hear much about prevention. It's all about treatment. And I think we need to start at prevention if we want to get to the core of this.
Prevention. And what do you mean by that?
So again, you cannot prevent disorders, but you can minimize the impact. For example, those who already have psychiatric disorders get worse by triggers caused by stress. People who do not have a psychiatric disorder pre-existing are prone to that when you're surrounded by stress. So stress management techniques, we have all heard about meditation, mindfulness, and others. But I think we can go a little bit beyond that. And when I say compassion, empathy, I truly mean that as treatment. Because if we are cognizant of what the other person is going through and stand in their shoes, we will probably as a society behave better. You talked about the curve. And I'm telling you, Kathy, the curve is going even deeper, meaning even from preschool kids, there's the depression anxiety setting on because we are always constantly judged. The social media has not helped us at all. I recently came across the term FOMO, fear of missing out.
Yes,
I think that
I remember you mentioning that to me, and that is so true. But let me just double click on something before we move on to that part of it, is because I think I mentioned to you, I don't know what day it was, yesterday or today, but that, this idea of always being stressed. I mean, we live in a culture where I feel like I'm told I have to be angry all the time. There's something to be angry about all the time. I turn on the news, I go on social media, I'm around my friends, just walking around. And it always seems like either I'm being told I need to be angry about something or I'm told to be fearful about something.
So you kind of brought out what I was going to say. When you say angry, anger turns inward, becomes depression. And fear makes it anxiety. So you have depression, anxiety right there. And then that leads to suicide. The reason is we need some more grounding, and that begins at home. And I think right now, because the parents, teachers, and students, everybody is stressed out, I think our focus has shifted from getting better to getting worse. Um, honestly, I think I would like to share a simple life lesson because, in the interest of time, I think I cannot get into the entire field of psychiatry.
Right.
But a simple life lesson that I learned has helped me navigate through my life. And I've shared it with my patients and friends and family, several of who have benefited from it. And being Father's Day weekend, I figure I should share it because this simple life lesson came to me not from med school, not from my psychiatry training, but from my dear dad, who taught me a life lesson when I needed it most. The reason I want to talk about this is the stress comes from decision making a lot of times. Now that we have more choices, you would think life is easier. In fact,
Right.
it's more difficult because you just see what other people are doing and then you want to do the same thing, whether you like it or not. In psychiatry, we talk about ego syntonic and ego dystonic. And I'm not talking about ego in the traditional sense. Ego meaning the self ideal, your own inner self. Each of us has our own inner self. We want to do something that aligns with our personality, our behaviors, our thoughts, and our views. That is where our comfort zone is. And when you function like that in society, when you just live by your own inner ideal, you will find much more peace than trying to emulate or imitate somebody else, which is actually ego dystonic. Ego dystonic behavior is opposite to that. So it is anti to your own self ideal. So you end up doing something that you are not. And then you end up feeling depressed, anxious, because there's a feeling of inadequacy. You're not able to fit into that new shoe. And that in turn can even cause obsessive compulsive disorders and other difficult psychiatric disorders. So this simple life lesson my father taught me, and if I may, I would like to share it
Yes,
because it
please
was a
do.
turning point in my life. Is that okay to do that now?
Yes, yes, please do.
Great. Being Father's Day, I thought let me honor my dad by sharing the story. So my dad was not a college graduate. He could not afford to go to college. My mother and he just had high school education. But one thing that he ingrained in both me and my sister were that people can take away your money, but they can never take away your education. That stuck with me from the beginning. He worked really hard and was very proud that both my sister and I became doctors. We were the first in the family to do that. And again, the credit to the government, it was funded because I had a merit admission. So that allowed me to go to med school. And I came over to the United States and did my psychiatry residency and my fellowship at the University of Cincinnati, which again, I'm very grateful. It was a wonderful program. I loved what I was doing. I was in my mid 20s, finishing up my geriatric fellowship. And I really was looking forward to getting a new job. I had many job offers. Everything was going great. I really enjoyed treating patients with depression, anxiety, cognitive disorders, Alzheimer's disease, helping their families. So everything was wonderful. On a personal level, though, I was again in my mid 20s. I had a toddler, 3-year old, and I was pregnant with my second child. And every day I would drop him at the babysitter's. Both of us would cry. He would cry and wail and holding his 2 trucks in his little hands and his
Oh,
chubby cheeks crying. And I would drive away crying, thinking I'm failing as a mom because my mom was able to stay at home, take care of us all the time. So did several of my friends and family members. So then I had a conflict. It's like, am I doing the right thing? Am I failing as a mom?
right,
But when I went to work, it's like, I love what I'm doing. I can't give this up. So I was racking my brains. People were giving me unsolicited advice, and I could see that no matter what I did, I would be wrong. I would
right.
be blamed. I did not know what to do. I called my dad. My dad, who was a high school graduate, but is a gold mine of wisdom. He has been my mentor and actually was my therapist as well. So I asked him, Dad, what can I do? And I explained the situation.
Right.
He laughed as always and said, Look, I'm not a doctor. I only have a high school diploma. And I'm not a mother. So I cannot tell you exactly what to do. But I can tell you a story which might help you. And this story, though sounds simple, is very, very deep. So it was a story which you might have heard. It's a father, son, and a donkey. The father, son, and donkey go through a village, and their legs hurt. So the son sits on the donkey, and the father walks on his side, and the villagers look at the son and say, "Oh, you son, so selfish, your poor dad is walking." So they switch. In the second village, the dad sits on the donkey. And again, of course, as you would expect, they comment negatively about the dad. So the third village, they both sit on the donkey. And as you would guess, they say, poor donkey, look at these people. So the fourth village, what do? They carry the donkey. So my dad said, if you listen to everyone around you, you will be the fools like the son and the father who carry the donkey. So he said, you know your situation best.
Mm.
You measure it, you decide what works best for you. And that's exactly what I did.
Oh
I'm
my
not saying that
goodness.
decision was, it wasn't right for other people, not even for my sister or my friends, but for me, knowing my situation, how I felt, what I did was I worked school hours. So I was able to put the kids on the bus, go and do all my work, whether it's inpatient, outpatient, nursing home, and teaching as well, come back in time for when they get off the bus. And I did that till they grow older into high school. And whether it's right or wrong, it worked for me. That brings me back to the ego syntonicity. For me, that was ego syntony because it aligned with my self ideal. And that gave me peace. And that is what I would say to everybody out there. The reason I'm here today is if this story helps anybody who is listening, I'd be very happy. Because if we can live with ourselves, right now we are in a social media frenzy that we see pictures on Instagram and people go off on vacations to places they didn't even want to go. You may not even like to ride a plane or stay in a hotel, but you do it just because a friend did that. We go on a fad diet because we think that's what everybody does, eat quinoa or whatever else is the fad for the day. If it doesn't align with you, don't do it.
Oh my
Do it
God.
because you want to. So if you can put your heart and passion into what you're doing, and I can guarantee there'll be millions of people pointing fingers, saying negative things about you. That's always the case. There'll be a whole bunch of people, if you're fortunate, who are your supporters and cheerleaders. And then there will be a set of people who don't even care. But at the end of the day, it's your life. You know yourself best. And I think you can be your best therapist. So I think if we can start with groundwork, feeling peaceful, calm, contented, and sure of what you're doing without wavering, I think that in itself you can see will calm you down. And you asked me earlier, you feel angry? You don't have to feel angry. We are angry because we're not sure. We hear some things, we are in doubt. So we begin to believe what the other person is saying, and that's the anger because it's an internal turmoil. It is not, you're not agreeing with it completely, but there's a conflict. But if you are sure and confident of who you are and what you want, that conflict will go away. Then you will see the resentment and anger is outside. You can look at it in a detached way. You look at it as a drama from inside. Okay, that's what he's doing or she's doing. That's what I'm doing. That's okay. And I think that's the beauty of life. We don't have to judge ourselves or anybody else. We don't have to force our values on other people. If everybody can live their own life, that is the beauty. God created us this way so we can have a life where each of us do what we are. And that's the beauty. We all come together. So that is the story I wanted to say. Actually, I went to India back. I went to my father, a few years later, 30 years later, when I was talking to him, I said, Pa, I told the story on his podium during my talks. And he said, you talked about my father's son donkey story on a podium in the great United States of America. He started laughing. That was a precious moment.
Oh my
Unfortunately, that was
goodness.
it was my last father-daughter moment. I came back in 2 days. I got a call. My dad had passed away. I went back for his funeral.
Oh
So
my
I really
goodness.
cherish. I'm thanking you, Kathy, for letting me honor my dad on this Father's Day weekend.
And not just honoring your father, but honoring us as well and giving us some priceless wisdom. I mean, I am literally sitting up here crying, and you had already told me this story before, but it just hits me, right? As a woman, as a mom, but in this culture, looking at my husband, everyone is trying to do their best. And usually it's because we're not trusting ourselves. Do we find ourselves in some sense of anger or despair or loneliness or whatever the case may be? So Geetha, thank you. You are amazing.
Thank you so much for having me, and I hope it helped people out there. Thank you so much, everybody. Happy
Absolutely.
Father's Day. Happy Father's
Yes.
Day.
Yes.
Thank
Thank you so much. Happy Father's Day to your son, Vivek, as well as to your husband as well.